Alright, so insulin resistance may be a part of the metabolic syndrome, and it has been associated with higher risk of developing heart disease. Insulin resistance precedes the development of type 2 diabetes. The cause of insulin resistance include both genetic and lifestyle factors. Insulin controls what the body does with the food when you put it into your body. Insulin resistance is the cells increasingly resistant to the effect of insulin trying to do its job. Being diabetic is the body can't keep up with the amount of insulin being produced. In the video, the doctor talked about how obesity is more looked at as like a coping mechanism of a deeper cause or deeper disease that's going on. Insulin resistance, they're looking at it as more of the cause. It causes obesity in most people. On average, in the video, the doctor said that about 75 million Americans' response to insulin resistance may be to store fat rather than not to. He also said that 30 million Americans with diabetes are not insulin resistant. And then 6 million lean people in America are insulin resistant. And he said that the lean people, the 6 million people that are American people that are lean or quote unquote normal weight, they are at higher risk for these metabolic diseases, like he said, being obese. It can cause Alzheimer's, heart conditions, and some other things as well. Foods that have glucose or excess, like blood sugar, or increase your blood sugar, are your refined grains and starches. Also, like foods that are processed, which nowadays is almost any and everything. A way to help stop this epidemic of insulin resistant would be to limit those foods that are starchy and those refined grains. Stop eating out. Definitely exercise. And stop taking in those bad fats. Some more statistics. 40% of all cancer cases are related to obesity. Obesity cost, on average, according to a website that I had found in 2008, the medical cost for obese patients was $147 billion. This is $1,429 more in medical costs than those people of medical weight, because you don't have those like the diabetic ulcers, you don't have all that extra medical attention that you need when you have that normal, quote unquote, normal weight. The U.S. is number 12 on the list of obese countries, according to the website I found in 2016. And at this time we were at 36.2%. In the U.S., men have 35% obesity and 38.7% overweight. With women in the U.S., 40.4% are obese and 26.2% are just overweight. Not just overweight. Overweight is not good either. Yeah.